Okay. Yeah. Good afternoon, everybody who has logged on to the call. This is Ramanan, Mission Director of Atal Innovation Mission. It is indeed wonderful to connect with every one of you. First and foremost, it is a pleasure and a privilege for me to be announcing yet another very, very important partnership that we are launching today with Aster, who are a leader in healthcare. And I have the pleasure and privilege of having Dr. Satish Prasad Rath, who is the Group Chief and Innovation and Research Officer at the Aster. He is also a physician come scientist. His research areas involve sustainable health system design, which is based on meaningful patient engagement, artificial intelligence that automates mundane processes and finds the needle out of the haystack, IoT that makes entire connected health system data-driven and proactive, and finally, a health system that's driven by a core value of empathy and trust. Indeed, it is a pleasure and privilege to welcome him on an occasion, I think, which is fitting, and the occasion being that of seeing how we can, together with Atal Innovation Mission and Aster, create a vibrant ecosystem of innovation and entrepreneurship in the healthcare segment that is so very important for our country, and not only for our country, but also for the world. After all, a COVID-19 crisis, which has created tremendous disruption to lives and livelihoods, it has created national lockdowns, it has disrupted supply chains across the world as well as in India, and it has created a fear of uncertainty of what the future holds for us. What about the other global pandemics which are lurking in the horizon? What about climate change and sustainable development goals that we talk about, and climate change disasters that we anticipate but which we have not yet experienced the ferocity of? What about the other challenges related to basic access to healthcare, medicine, affordable clean drinking water, sanitation, waste management, and so on, all of which are linked to a country like India, which is 1.3 billion people. After all, we are a large country. We have more than 715 districts. We have over 4,000 small towns and cities. We have more than 650,000 villages. We have only 8 tier 1 cities in our country. And even though India has been seeing a fantastically growing economy at 6 to 8% over the last several years, barring the COVID-19 crisis, it also has many, many challenges that we need to face. 22% of our country is still below the poverty line. 44% of our country is still agri-economy based. And out of the 715 districts that we talk about in our country, we still have 115 of them as aspirational districts, because they are at the bottom of the pyramid in terms of basic access to healthcare, education, telemedicine, medicine, medical devices, as well as affordable housing, clean drinking water, sanitation, and so on. So it is very important for us to be able to address all these challenges, even as we grow as a nation. Deliver to the people. Then we have the fast growing economy that we said, but more importantly, we are having technology reshaping the landscape of the world. Technology that is creating huge impact because it has become affordable, accessible, available, and advanced. And therefore, in light of all of these, it becomes very important for Atal Innovation Mission, which is a flagship initiative of the NITI Aayog, the National Institution for Transforming India, to ensure that we empower our young people, our young students who are graduating from schools, entering into universities, and then who are graduating from universities and entering into the industry, to be able to have access to the latest tools and technologies upon which solutions and innovations are being built, solutions of tomorrow, solutions aligned to the sustainable development goals, and solutions that can create that can solve the problems of the socio-economic divide, the digital divides that we experience still in our country and many emerging economies experience all over the world. And therefore, the Atal Innovation Mission is very proud to have this partnership with Aster, who are a leader in healthcare and who are also leveraging technology to the capabilities that it can bring in the medical world as well as in the healthcare world. As most of you are aware who have joined this call, the Atal Innovation Mission has a series of innovation initiatives in a very holistic manner. At the school level, we have launched thousands of Atal Tinkering Labs, which will create and breed a culture of innovation and problem solving and innovative thinking in our young school students. At the university level, we have launched hundreds of incubators, which is fostering thousands of startups. More than 1,900 startups have come up in the Atal Innovation Mission fold in the last 3 to 4 years, with more than 575 of them as women-led startups. At the community level, we are setting up Atal Community Innovation Centers so that these centers become the hubs of innovation and local job creation, community-centric innovation, community-centric job creation, so that our people don't have to migrate from our tier 2, tier 3 cities or from our 650,000 villages and flock to these 8 tier 1 cities, but they can find local opportunities for job creation and innovation. And in order to be able to create solutions for specific challenges that we have in our country, we launch what are known as Atal New India Challenges and Arise Challenges. And these challenges are meant to stimulate product make in India innovations so that these innovations can be applied. And there is a market ready to absorb them and enable our startups to grow. Indeed, India is a country of 1 billion people with 1 million challenges, but these million challenges are 1 million opportunities for all of us to be able to convert and create entrepreneurial units. And therefore, it is my pleasure and privilege to introduce to you Dr. Satish Rath, who will share his perspective and his views on how this partnership can enable Atal Innovation Mission and all these initiatives that I'm talking about being able to leverage innovation, technology, and their support, their market reach, their domain knowledge to make India a much better place, not only for all of us, but for the rest of the world. So over to you, Dr. Satish, for your introductory words on this particular partnership.
Thank you so much, Mr. Ramanan. I'm totally humbled as well as honored and privileged to be, selected by the great initiative Niti Aayog has done under AIM, especially I think you. So the nicely you have, elicited the kind of challenges, but we are not considering the challenges as the challenges which cannot be solved, but challenges, which we can really convert into opportunities. So we will be playing a short part, and I think you have already done a lot of work when it comes to introducing technology, empowering the students from school to the universities, universities to the outside industry, and as well as, how technology can transform lives. I think where the healthcare industry, especially doctors, so doctors are also trained to be scientists, but I think somewhere I will take that responsibility that, we have not enthused entrepreneurship and invention as a research inside the doctors community. That's where maybe we are slow in inventing new things. We are always depending on the engineers to invent and then give it to us, and we are actually using them in a very late cycle of invention. So that I see as a fundamental challenge why healthcare adoption is happening late. On the other side, I think the due contribution that should have come from clinical scientists, especially we saw also in COVID, the vaccines came from the biopharmaceuticals, the other solutions came from IoT or let's say AI, firms. But I think as clinical scientists, we are still looking outside our fraternity for somebody to solve something. And that I think is not a status quo which can take. So me being a doctor myself, as well as a scientist, I feel this, there is a big need where doctors need to do their due contribution towards, solving the solutions of the problem. So somewhere I like this idea very much, when you said that, you are empowering students. So I think somewhere we need to empower the medical students. We need to train them. What is the capability and the real opportunity AI or deep learning really provides so that, they can start becoming inventors, entrepreneurs, and then, can churn out problems into opportunities, very soon. And that's where, I'm deeply impressed with the great initiative, what Niti Aayog has done. So I feel this is our side of the things to do now as hospital providers or as doctors or as network of healthcare providers. When I came to the healthcare provider segment, because I have spent most of my time in corporate research, so working at Philips Research, at Intel Research, at Xerox Research, inventing things, and there I always felt that as we invent as scientists, as we give it to the doctors, they always find that no, you should have asked me before inventing this. So that was a gap which was changed. So somewhere at Aster we formed this clinical simulation lab. The clinical simulation lab actually works on a principle is we involve the users right from beginning of the cycle of invention. So all the startups, currently as they are facing this challenge, whether doctors are going to like it or not, even if they like it, whether they're going to buy it or not, even if they buy it, are they going to buy it in a large number so that, we can be sustainable, which you very nicely elicited out. So in this clinical simulation lab, activity, what we are going to expose to them, all the great startups who are in healthcare already selected by Atal, Innovation Mission, they can come and talk to the real end user. It can be a nurse, it can be a, let's say, technician, it can be a doctor, it can be a specialist, it can be a healthcare IT person, it can be a CFO of the hospital, whether they are ready to buy it at that cost or not, so that they can really know what modification they need to do to their startup at the stage, whatever they are, so that they can be successful. If they are successful, we as doctors are also going to be, that invention is going to be helpful for us because, they are solving some problem for us. So, commonly instead of, working into silos, they can start working, taking the insight from us. The next big thing is, where I think, we have a great advantage being India of our billion plus population, which has been considered always as a very big, let's say, challenge for us. But I strangely, and I strongly feel that, due to deep learning, that is our biggest advantage. We can really, contribute a lot due to our population, sheer population size. So each hospital, like, as Aster also, we have collated all our data as a data bank. Now, if I'm an AI scientist who is working on deep learning, be it on long sequence reading or be it on AI models on radiology or pathology, I need to test. To develop an AI model, I need the training data, then I need to validate it. And this cannot happen without the good annotated and structured, high quality data. So what at Aster, we have started this as the first in the region, we can say, this is the first in Asia, where, we are listening to the problems of the AI scientists to say, you want to do something on ultrasound, you want to do something on pathology, you want to do something on radiology. You can develop your hypothesis. As you start your hypothesis, take the feedback of the doctors, whether they need it or not. If they need it, then, take the data, develop your hypothesis, go working with our AI scientists on the real data, so that your chances of success of these AI models is going to be more and more sustainable. So we are going to provide these two things, which is complementary. Somewhere it is also our responsibility that, the great startup ecosystem which is happening, can they simulate their startup hypothesis or their models on real world evidence? It is not going to be on, let's say, some abstract or some thinking or some PowerPoint, but they can really talk to the real doctors, the real patients, the real specialists. On the other side, they can really experiment their models on the real, data bank. So these two things I strongly feel is going to transform the way digital health is going to be adopted in the country. Currently, I don't see there is dearth of digital health startups, but there is definitely dearth of adoption of the digital health startups. As a hospital provider also, we do see that, we come across a lot of startups, but the real question is asked, is it going to work for my patients? Is it going to be easy to integrate to my hospital infrastructure? And how my patients are going to react to it? So there is definitely adoption challenge. We cannot run away from that. But we can solve this through this clinical simulation lab. So we can provide this last mile kind of a thing, or let's say the finishing touch or the finish for already existing startups. On the other side, I really like your idea when you say, we need to go for challenges or go for those kind of, let's say, ask, which is specific for India, which will definitely empower Make in India, which will definitely empower those problems which needs to be solved in India, not necessarily, those solutions which has been invented outside, then, pushed for the Indian users, because, we are importing those things. So in that also we can participate, and I feel this is much more fundamental. If we can really tell the startups which kind of problems they really need to solve, this is going to be really transforming, them. It is also going to give them a lead, which kind of problems they need to solve, so that they don't have to really waste their time thinking about, which is the priority segment they should be really solving about. So I would say these are my initial comments. I'm really, really happy and really, really impressed. And really, I think, I feel responsible that, healthcare providers and doctors are late to the game. I think, AIM has done its necessary step. It is our due responsibility now to complement, the good work what we have started on.
Thank you, Dr. Satish, for, I think, a very comprehensive elucidation of the value proposition that Aster intends to bring to the table in terms of this relationship. And I think all the startups who have logged on, or all the AIM beneficiaries who have connected on this call, I think this is the real advantage that he talked about. These are the issues that we have. When we create an innovation or anyone creates an innovation, before you even launch upon creating that innovation, how important it is to validate the idea behind that innovation, and how important it is to bounce it off the real intended beneficiaries. The beneficiaries are the patients or the doctors or a hospital or a healthcare provider. And if you are creating a solution for any one of them, it is very important for you to see how you validate your idea or your prototype or your model against somebody who is in that field and who is constantly interacting with the real people who are going to be using it. And I think that's a fantastic value add, so that your solution becomes refined and matures into something that can create tremendous impact. The second thing is, as Dr. Rath pointed out, that they have set up these clinical simulation labs and so on. And simulation is very important in medical devices or in any innovation related to healthcare, because you don't want to directly test it onto a patient. That even to just test out a virus, you have to go through so many test trials before you are able to release it to the human being. Now, that's true for any healthcare related innovation, because you're playing with the lives of people. And therefore, it is very important to have access to such labs and such experts who are able to help you in your journey of your innovation. And the third point that he mentioned is, which is very, very important, is they know in the health, being a healthcare service provider and someone who's dealing with issues and problems on a daily basis across the length and breadth of our country, they are familiar with the challenges that are there, which are yet not solved. There may be solutions for some of them, but they may be suboptimal, or there may be solutions which are too costly, and we want to find more affordable solutions through Make in India innovations. Now, all of these become very important factor in identifying the challenge, being able to validate the challenge as an important need, and then creating a solution for these challenges. And those of you who are winners of Atal New India challenges or Arise challenges in the healthcare segment, you will have the great benefit of associating with this partnership and ensuring that your solutions are validated and that you have actually met the challenge from a beneficiary point of view, not just from a innovation, academic innovation point of view, but from a beneficiary point of view. And finally, I think it's a very important thing, even at the tinkering labs, for young students to understand what are the possibilities in the healthcare world, in the medical world, in the fitness world, for example. And there are so many innovative solutions that are required in the wellness area, in the fitness area, in the healthcare area, in medical devices area, and so on and so forth. Today, the virus, for example, has created the need for so many sanitizing solutions, contactless surfaces, so that you are minimizing contact. And if there is another virus, similar virus later on, you will need all of these solutions. So it is not solutions that you're developing for COVID-19, but in a post-COVID-19 world where such possibilities exist or variants of the virus can come, you will have need for these solutions. And now forewarned is forearmed. So we have been forewarned about what are the possibilities when such a pandemic breaks out, what are the solutions that we can anticipate to be developed in anticipation of other problems in the future. So I think it's great that Dr. Satish has shared his vision of how Aster can be a great partner to Atal Innovation Mission. We are very, very thankful to this particular relationship and this partnership. Manglesh, can we go ahead with the next steps of formalizing this relationship? We have an SOI signed today between Dr. Rath and Atal Innovation Mission, Aster and Atal Innovation Mission. And I'm very, very happy to announce the inauguration of the same. Dr. Rath, any other points that you would like to make to the young startups, to the budding innovators, to the mentors, for example, who are out there, to the healthcare community, which is very interested in finding new solutions? Any other words that you would like to share on this very, very important occasion?
First of all, thank you so much, Mr. Ramanan, for this opportunity to make us able to contribute for India's healthcare journey. I'm very optimistic that, with doctors' participation, into the invention cycle, which they should be really, equal participant in this invention cycle, we can really fast track the inventions, whatever is needed. And especially as you said that, because we face the challenges, we have vested interest to solve these challenges and these problems. If startups come up with the solutions, there won't be anybody more happier than the doctors or the healthcare systems, because, we want to solve these problems for ourselves. So there is a very big market. There is a very big problem area. So all the startups should be considering there is a very big opportunity area. So you have a lot of problem to solve. There is no competition. Even if you have 1,000 problems to be solved, still we have having problems to be solved. So that's a great area to be in. You can prioritize the problems from us. So that is again a great area to be in. Again, to conclude that when you have the risk of predicting the chances of success of your startups, that is always based on evidence generation. And then through this clinical simulation lab, you can actually generate your evidences so that you can go for your regulatory approvals, as well as you can go for your business approvals, you can go for your seed rounds, and you can go the next levels, keeping on having the evidence. So you can consider this partnership, which is between Atal Innovation Mission and Aster Innovation Research or Aster's DM Healthcare, is to help you, is to accelerate you, is to solve the problem which is jointly owned by us. So the solution also we are keenly looking for. So because we have the vested interest inside, solving these challenges, I strongly feel we can really solve the challenges of India. So I'm again, deeply thankful to Mr. Ramanan as well as his entire team for considering this unique opportunity. And also I feel very, very happy that, there are only 4 clinical simulation labs in the world. Out of them, 2 are actually in, Denmark, because they are design related. One is actually in United States of America, and this one, what we are starting, is actually the 4th one actually in the world. So this is a very unique program. This is way beyond the design thinking, or let's say the Stanford bio design kind of a thing, which is a little bit away from the practical challenges of India. Here we are starting with the practical challenges, as well as we are encouraging people to have the practical solutions, so that these are solutions which our common people can buy. These are solutions which our common hospitals can actually implement and adopt, as well as these are solutions which will be built by our young IIT graduates or NIT graduates or our biomedical engineering graduates, as well as our doctors. So this should be built by us, this should be built for us, as well as this should be used by us. So that is something I think, democratization of innovation, and this is very much needed for us. So there is a big area to solve for us, and this is a very optimistic journey what we have started in. Again, I'm deeply thankful to the entire team of AIM, who has worked for this. We are all in for this. And other than just having the hospitals at Aster, we do have a medical college. So in that way, we are very different from the rest of the corporate hospitals. We are deeply entrenched for academic invention, as well as we have our own research team, which is working on, let's say, a few of the challenges like how the AI models are going to work for radiology, pathology, how insulin can be brought into lab on a chip, or how infection monitoring can happen. In fact, we are working on something which can be a treatment for COVID. So we are a research house like you yourself, and the vibrations are going to match. You're going to enjoy this journey, and we are going to listen to you where, all this while you have been always facing these challenges, okay, the doctors don't get it, or they are not understanding us, or maybe the healthcare organization doesn't get it, or they are too slow to adopt. So first time, we are having also AI scientists from the doctor side, as well as, let's say, from the healthcare side, so that, your vibration can be understood, your problems can be understood, your problems can be heard. And we intend to provide this journey of co-creation instead of, you creating something and giving it to us, trying to sell it to us. Let's co-create so that, we can co-build towards the sustainable healthcare system. Thank you so much for this partnership. I'm equally excited, deeply honored and humbled for this. And we can definitely say that, this is the responsibility from the doctors community, how we can solve the AIM's mission for healthcare for all in India.
Thank you, Dr. Satish ji. Indeed, co-creation is the word, and this is a fantastic opportunity for all the young startups and the budding innovators to co-create with the beneficiaries, the doctors, the hospitals, the patients, and that's when innovations have the maximal impact. And it is indeed a tremendous thing that, of the 4 clinical simulation labs that you mentioned, one of them is going to be in India, and that is what you're offering as access to all the budding innovators. So what can be more exciting than this particular news? Thank you so much for enabling all of this. Of course, we will follow this up with a series of some webinar sessions, experts that you can organize, sir, from your side, healthcare experts, AI experts, or technology experts, or clinical simulation lab experts, so that the startup community associated with healthcare, medicine, medical devices, not only from Atal Innovation Mission, but across the country, will be able to benefit from that knowledge and see how they can access and get further empowered with the facilities and the help that you're providing. So thank you so much. Indeed, a pleasure and a privilege today for be signing this agreement. And I hope all the innovators out there are tremendously excited to see this partnership unfolding in front of their eyes and to be able to take benefit from this partnership. This is Ramanan, Mission Director of Atal Innovation Mission. Thank you all for joining once again. Deeply grateful to you for having spent your valuable time for this particular webinar. And once again, thanks to Dr. Rath and his team for enabling all of this for the Atal Innovation Mission and for the Government of India. Thank you.
Thank you so much.
Thank you so much, Dr. Satish. Thank you, Ramanan sir. With this, we start the beginning of our operationalization. Thank you so much, sir.
Thank you.